Ladies and gentlemen, especially invited guests, I'd like to thank you for coming and paying some, hopefully paying some attention to the report that I'm about to discuss here. I represent the Department of Biomedical Engineering at UTT. It is one of the younger programs emerging from that institute. It is geared toward filling the international void in the health sector regarding medical instrumentation, design and operation, and also clinical research. My talk today is based on some work that I have done. I have initiated in the past through my alliances with the University of Southern Mississippi, and it is presently being reviewed for approval to continue the work at UTT at the postgraduate level. It is titled The Development of a Photodynamic Therapeutic System for DNA Photocleavage, In Vitro Cancer Cell Growth Inhibition, and In Vivo Inhibition of Cancer Tumor Growth with Transition Metal Complexes. So, big title. Let's break it down a little bit. We're talking about photodynamic therapy. I'll in a bit explain to you what it is about. In vitro tests, we refer to simple clinical laboratory-based tests on petri dishes and tissue samples to see how effective the drugs are initially before going on also the clinical tests where they are introduced to in vivo systems, or starting from the stages, from the most insignificant of animals, the rats, the rabbits, dogs, moving straight on, as the FDA would require for the approval of these drugs. So, you'll have to excuse me, as you can see I tend to ramble a bit, and I'm given only 15 minutes to present this work, so I will be reading a lot of some prepared paperwork, and at the end of it, I'm hopeful that you will have some questions regarding this work. I'll be more than happy to entertain them at the end of the presentation. So photodynamic therapy, or PDT, is a product of nanotechnology research and is a relatively new area of practice in modern medicine. It involves the introduction of an active drug to the site of action through either intravenous and through the veins, or topical applications, and then a subsequent activation of that drug using harmless ambient red light. The electromagnetic spectrum seen here is a range of all the possible frequencies of radiation that exists in Earth or on Earth. And it is characterized by wavelength, which is inversely related to the energy or frequency, meaning that radiation with long wavelengths tend to have low energies. The drugs in question here they belong to the family known as porphyrins. One of the most common porphyrins, I believe one of the speakers mentioned it already, exists in nature, and that is one of the components in hemoglobin. It comprises that heme part. And they are responsible for the transport and uptake of oxygen in the blood. Porphyrins characteristically are responsive, very responsive to light, and that is due to the conjugated aromatic system seen in the organic structure. They are tetrapyrrole compounds, meaning four membered nitrogenous compounds, and macrocyclic, meaning they are cyclic in structure, as seen here, with 3 or more donor atoms being able to bind to a central metal ion center. There are several PDT agents presently approved by the FDA on the market, and these include ALA, which is used to treat actinic keratosis and basal cell carcinomas. These are simply skin-related cancers. We have Foscan, which can be used to treat advanced head and neck cancers, and Photofrin, which is used for palliative treatment. And this simply means, when we say palliative treatment, it addresses the symptoms of the cancer, and it eases the pain and the suffering of the patient. It usually extends their life as they go through that cancer treatment. The advantages of PDT, first and foremost, it is less invasive than surgery. We all know that when we go to the hospital, the first thing we're going to tell the doctor, please don't cut me, right? So anything that would avoid that blade or scalpel, we would want to entertain. It can be targeted very precisely, and unlike radiation, PDT can be used repeatedly at the same site if necessary. And last, PDT may result in less scarring than its predecessor techniques. Regarding the success stories of PDT, they are presently being used in esophageal cancer treatments, ENT squamous cell carcinomas or ANO's throat treatments, age-related macular degeneration, head and neck cancers, and cancer of the bladder. So, the proof is in the pudding. Let us take some time to look at the documented examples of the use of PDT techniques and its success stories. I should warn you that some of these pictures may be a bit graphic and disturbing, so please take this as fair warning. So, an example is the use of MTHTC, which has been used to treat a cancer occurring in the mouth. This first picture here, this is the site of action where there's a bloom of cells at the corner of the patient's mouth, and this picture was taken right before the PDT treatment. Here we have the patient 24 hours after the initial PDT treatment. Here we have 7 days, and after 4 months, we can see the total full removal of the cancer. So we consider this to be a successful treatment. When a similar treatment was done on a patient who had undergone surgery for the removal of a breast cancer, the lesions had progressed despite salvage surgery, full dose radiation, and chemohormonal therapy. This photo shows the lesion after 1 month after using the PDT technique. And finally, here, we see the photo being taken after 3 months after using the PDT, and the patient exhibited excellent healing, and she no longer required narcotics for pain control. Now let's look at another example. Here the drug verteporfin was used to cure age-related macular degeneration. Picture A correlates to normal vision here. And in this case, the fluid-filled sac in the eyeball tends to degenerate with age. It becomes fibrous. So as you get older, these fibers, as they begin to develop, pull away from the retina of your eyeball. And once it dislodges from the retina, we get this symptom of blocked vision. So PDT treatments, in this case, will tend to remove or aim to remove this growth from the retina and thus restore the patient's vision. So now let's look at the video which relates to the use of PDT, in this case of age-related macular disease. So here we have the procedure of PDT, which uses the relatively inactive drug and its subsequent activation through a low-power laser. In this particular treatment, the drug is introduced intravenously and is transported via the circulatory system throughout the body. It was observed that although the drug is distributed throughout the body, there is a higher concentration of the drug in the cancer cells, and one of the presenters explained why. So that was good. The site is then irradiated. So here we see the drug impregnating itself within the cell. And now we are ready for the second phase. So now we are seeing the site being irradiated from the external light source, which breaks down the cell group. Seen here. So what happens here is that the light excites that drug, and the excited energy from the drug is now transferred to molecular oxygen, which is present in that system. We know our cells have oxygen. The oxygen in turn now becomes excited and highly reactive, right? And this leads to oxidation of the lipids that are contained within the cell wall and the cell organelles. Apart from this, there is an increase in the toxic level of the cell, and this then leads to cellular apoptosis, or the destruction of the cell. But here's another side reaction observed, especially when photofrin is used. Here, we see a mediated vasoconstriction. So basically, the veins and the arteries tend to contract in the presence of the drug. And this leads to platelet clotting. This platelet clotting, then you would see the clots moving and blocking the system, which starves that system, that tissue, that localized tissue of oxygen and blood. And therefore, that leads to something called ischemic necrosis. Right? So, Bdg looks to be the perfect thing then. But no. Like all drugs, there are always side effects associated, and there are problems with it. So, let's look at them. Bdg only works Bdg works only in exposed areas areas exposed to sufficient optical flux, because we remember that we need some sort of external light source to excite that drug in the system. If light cannot get to the drug, Bdg is ineffective. Secondly, Bdg leaves patients very sensitive to light, and patients have been recommended to avoid bright light for up to 3 months after treatment. So they have this. Sometimes people call it porphyria. Sometimes it was a joke saying, but actually documented that was the story where vampires came from. They actually had to stay indoors and away from bright light. If you went out to the light, it may be funny, but actually it was documented that is where vampirism came from, right? Because Bdg, and allow me to just ramble a bit. There are medical cases where there are higher concentrations of porphyrin in human blood systems, and these people cannot go out to the sun, right? So when they go out, they tend to get blisters. You know, when you watch the vampire movies, you see them go in the sun. Something not as dramatic, but something very similar to that occurs. So that is the case what they call porphyria. However, to address this problem, recent research breakthroughs from a company called Clinovel has come up with a drug called alpha-melanocyte. And this increases the production of melanin in your skin. So then melanin, as we know, gives you that dark complexion. An increase in melanin would therefore then give that patient that much needed barrier against it. So that problem is being addressed right now. With respect to the drugs, they are not readily available due to the high cost and difficulty in production. I can lay testament to that because it took me 3 months, working practically 7 days a week, almost 24 hours a day, to create 1 Bdg porphyrin while I was at USM. And that was in the milligram quantity. So that is true. It is not efficient due to hypoxia. Hypoxia refers to the medical condition where there's a lack of oxygen at the site. Now, we go back to the video where I showed that we need oxygen for the transfer of that energy from the Bdg agent to excite the oxygen and then destroy the cell. So if there is a lack of oxygen, as characteristically there are in cancer cells, that is going to be a problem. So therefore, a new method needs to be developed to overcome or circumvent that problem with oxygen. So new drugs need to be developed in that case. And finally, side effects such as sustained swellings and pain usually occur. But this is due to the hardness of some of the patients, because after the treatment, the doctor usually definitely will tell the patient to stay indoors for a certain period. It is seen that the patients who disregard the doctor's instructions and venture out saying that they know more than them suffer these consequences of this. So, through my past work with the University of Southern Mississippi, I have started the synthesis of a family of novel Bdg agents that can be used in the absence of oxygen. And this here is the macrocycle, or the porphyrin that I developed while I was out there last year. This venture is now being looked at by UTT, as I mentioned, as a potential graduate-funded research, and will continue to be done in alliance with the University of Southern Mississippi, or USM. The objectives of this project would be as follows: the incorporation of ruthenium, which is a metal, and other transition metals to form a novel class of organometallic compounds. And why transition metals? Well, literature has shown that ruthenium and rhodium, which is another metal, I will show you in a while what they are and where they are located, tend to display binding interactions with DNA. And this led to photo-induced cleavage of the helix in the absence of oxygen. And secondly, we are aiming to design a more portable and more efficient light delivering mechanism, because presently in the hospitals and in the US where PDT is being used right now, they have these large machines where the patient has to go and get the drug injected into them, and then the treatment starts there. What they are now looking at, they have, if you can Google them as well, they have devices resembling this mouse, where you go to the hospital, they give you the intravenous delivered injection with that drug, and then you go home. And when you go home, in the comfort of your home, you can plug this on and shine that light on those areas, and you have your own treatment. So you become your own doctor, and you can do it at your own convenience. The problem with this now, so that is fine, and we would want to go somewhere like this. If you go back to the electromagnetic spectrum, one of the slides that I showed you, we are able to see the colors of the rainbow when it's combined. It's called white light. That's the visible light spectrum. As I mentioned, at one end of the spectrum, you have long wavelengths, low energy, short wavelengths, high energy. You want, ideally, to have a long wavelength, low energy system, which goes now from the red, as I mentioned, you're using harmless red light, to the very close near infrared region, such that the longer wavelengths will tend to be more penetrative, but less harmful than even the red light. So that is something that our biomedical engineering department is going to be looking at. Seen here is the Bible, or the backbone of chemistry. This here is the periodic table. And the site of interest is shown here. This here is where the transition metals, or the D-block elements, are found. The use of transition metals in modern medicine is nothing new, and these metals highlighted here, we have vanadium, zinc, ruthenium, rhodium, silver, osmium, platinum, and gold have been known to be used to treat several diseases such as arthritis, diabetes, and cancer. With respect to cancer, these organometallic drugs are presently being used today in the technique known as chemotherapy. The most prominent is this one called cisplatin. Cisplatin, here we have the platinum transition metal, which I just showed you. And in some of the others, the analogs of them, we have organic moieties. So that is where we get the word organometallic compounds. So as UTT embarks on this very ambitious level of research, we continue to look forward to the support of the people of Trinidad and Tobago as we strive to make this project a success. And here I will show you, give a sneak peek of some of the compounds that we are aiming to synthesize in our lab. These will have potential PDT. They will be potential PDT agents, as they already have the porphyrin moieties or structures in them, so they will characteristically be responsive to light. Finally, I'd like to thank UTT for their continued support to my ideas and my work. to the CIES for granting me the Fulbright scholarship that took me to USM to see the successful initiation of the work, to Dr. Alvin Holder and Mr. Tyler Weaver, who are continuing to work hard in this area of research, and finally to the Arthur Lockjack School of Business for giving me this opportunity to discuss the work that is being done at my campus. Thank you all.